Have you ever had a cocktail conversation with somebody about pain tolerance? Maybe you have a high threshold for discomfort, while the person you're talking to says it takes very little to be in a world of hurt. However, experts say everyone agrees about the intolerability of 3 kinds of pain: childbirth, gunshot wounds, and one stone you don't want to romance, the kidney stone.
They can be really, really painful. Sometimes they're detected by accident. If you're having an ultrasound or a scan for another reason, it turns out that you have stones in the kidney. Sometimes you go for your routine physical examination and you end up having blood in the urine, and the investigation shows that it's due to kidney stones. Sometimes you come to the emergency room with severe what's called colic or pain due to passing a stone, and that's what your classical severe pain is due to kidney stones.
That's Dr. Irvin Bonder, an attending urologist at St. Clair's Hospital in Denville, New Jersey. He says a kidney stone is more or less a small rock that forms in the kidney when certain chemicals clump together. Extremely small stones may be passed through the ureter, the bladder, and out of the body. It's when the stones get stuck that creates problems. Bonder says each year more than 500,000 people go to emergency rooms experiencing kidney stone pain, resulting in as much as 1% of all hospital admissions. He says it's easy to spot someone suffering from stones as soon as they set foot in the ER.
Well, if they come in with pain from a kidney stone, you can pretty much identify them from across the room. They come in, they're hunched over, severe pain. ER doc or the nurse who sees them at the hospital will generally get them in right away and try to control that pain to a certain extent. Once the pain is under control, then the idea is to find out exactly where the stone is located, how big it is, how much obstruction it's causing, in order to determine how to treat that stone.
And the pain? If you've never had a kidney stone, don't ask. The National Kidney and Urologic Diseases Information Clearinghouse classifies it as extreme. Typically, it starts as a sharp, cramping pain in the back and side or in the lower abdomen. Later, pain may spread to the groin, and if that isn't bad enough, one can also expect nausea and vomiting. And all of this is going on while doctors are working on a patient to figure out what to do.
Then we try to identify where the stone is from the x-ray, and the x-ray is usually nowadays a CAT scan, and the CAT scan will tell us, is the stone in the kidney, is the stone in the ureter, is the stone close to the bladder, where in the ureter is the stone located. It will also generally tell us the size of the stone. And based on all those things, we determine what the next step would be to manage that patient.
But not without first identifying which type of stone it is.
Certain stones are very hard and will not break up easily, no matter what mechanism you use to try to break the stone. If you have a uric acid stone, if it's not causing a lot of obstruction, we can even dissolve uric acid stones. And that's done by alkalinizing the urine and increasing the fluid intake. We have a chance of actually dissolving uric acid stones. And those are about 10% of the stones are uric acid stones. Calcium stones don't dissolve, and those stones we have to manage with either what's called uteroscopy, whereby we pass a scope up the ureter and either break the stone up with a laser or other mechanism to break the stone up, or remove the stone with a basket or bypass the stone. And that's uteroscopy. If the stone's up in the kidney, sometimes we'll do what's called percutaneous nephrolithotomy, and that entails putting a scope directly through the flank, directly into the kidney, and then breaking those stones up into smaller pieces that can be brought out through the side. And there's just a very small incision that we use to do that.
Until the 1980s, if a kidney stone couldn't be passed, open surgery was the only option to remove it, and that meant 4 to 6 weeks of recovery time. That all changed with the invention of the lithotripter. Today, it's the most frequently used device for the treatment of stones.
The first procedure in the United States was done in 1984. The original machines were in a tub of water. The patient was immersed in a tub of water, and while immersed in water, we were able to focus a shock wave on the stone. And when I say shock wave, what we use is something to generate power and generates a shock, and that shock is then focused on the stone. These shock waves will go through water and body tissues without causing any injury. When it hits something hard like a stone, it starts to fracture or break the stone up.
Shockwave lithotripsy in many cases is done on an outpatient basis, and most folks are back to normal activities in just a few days. But wouldn't you rather avoid all of that in the first place? For some people, that's easy. If you've never had a kidney stone and they don't run in your family, Bonder says odds are you won't develop one. And if you follow doctor's orders, you'll increase your odds even more.
By far, the most important thing is to drink lots of fluids. That's by far the most important thing. There are a lot of different reasons for people forming stones. It could be a metabolic issue. For example, they may put out too much calcium in the urine, and there are a number of reasons for that, potential reasons for that. It could be that they're not producing enough citric acid, which goes out into the urine. Citric acid is a stone inhibitor. Patients who have a low citric acid, for example, we may treat them with lemonade, ask them to drink a glass of lemonade per day.
Dr. Bonder also advises stone-prone patients to go easy on the animal protein, like meat and eggs.
High-protein diets predispose people to either uric acid stones or calcium stones, both of those. A lot of those people are drinking less fluid, more protein, and they're more prone to making those type of stones.
And while lots of water is good for you, it's easy to overdo alcohol, coffee, and other caffeinated beverages. Caffeine raises calcium oxalate, the building block of the most common kidney stones. And too much liquor leads to dehydration. Salt contributes to kidney stone formation as well. That's why Bonder suggests limiting foods with large amounts of sodium, like hot dogs and canned soup. But despite all those efforts, sometimes nothing seems to work. For a few people, all they can do is wait for the next time the pain starts.
There are some people who are just basically stone machines, and pretty much whatever we do, they just keep making stones. I do have a few of those in my practice, and it's difficult, but not everyone we can prevent from making more stones.
So our efforts to prevent kidney stones can only go so far. In fact, while we know a lot more about kidney stones than we used to, the number of people in the U.S. with kidney stones has been increasing over the past 30 years. But they're far from a modern malady. Scientists have found evidence of kidney stones in a 7,000-year-old Egyptian mummy. Our writer this week is Bill Ezrin. Our production director is Sean Waldron. I'm Nancy Benson.